Your kidneys are working right now to keep you alive, filtering your blood every single day without you even thinking about it. But what happens when they start to fail? Most people don't realize they have kidney disease until it's already advanced. The truth is, your body sends warning signals long before things become critical. And today, I'm going to show you exactly what to look for and what you can do about it. These two small organs, each about the size of your fist, filter approximately 50 gallons of blood every single day. The kidneys remove waste, balance your fluids, regulate your blood pressure, and produce hormones that keep your bones strong. When kidney disease develops, it happens silently and progressively. By the time most people feel symptoms, they've already lost significant kidney function. In the next 15 minutes, I'm going to walk you through the 10 most important warning signs that your kidneys might be in trouble. Explain what's actually happening inside your body when kidney disease develops, and give you proven strategies that can help protect and even restore kidney function. Some of what I share today might surprise you, because the pharmaceutical industry doesn't always want you to know that lifestyle change can be just as powerful as medications. Let's get started. The first and most commonly overlooked sign of kidney disease is persistent fatigue that doesn't improve with rest. When your kidneys aren't filtering properly, toxins build up in your bloodstream. This condition, called uremia, makes you feel exhausted no matter how much you sleep. Your body is essentially being poisoned slowly, and that constant toxic load drains your energy. Additionally, damaged kidneys produce less erythropoietin, a hormone that tells your body to make red blood cells. Fewer red blood cells means less oxygen reaching your tissues, which leads to anemia and profound tiredness. Warning sign number 2 is swelling in your ankles, feet, or legs, especially at the end of the day. When your kidneys can't remove excess fluid from your body, that fluid accumulates in your tissues. This is called edema. You might notice your shoes feel tighter, your socks leave deep marks, or when you press your finger into your ankle, the indent stays for several seconds. This isn't just uncomfortable. It's a clear signal that your kidneys are struggling to maintain your body's fluid balance. And that imbalance puts strain on your heart and cardiovascular system. The third warning sign is foamy or bubbly urine that looks like the foam on a freshly poured beer. This happens when protein is leaking into your urine, a condition called proteinuria. Your kidneys contain millions of tiny filters called nephrons, and when these filters are damaged, they allow protein molecules to pass through when they shouldn't. Healthy kidneys keep protein in your bloodstream where it belongs. Warning sign number 4 is changes in urination patterns. You might need to urinate more frequently, especially at night, a condition called nocturia. Or you might feel a constant urge to urinate, but produce very little when you try. Some people experience the opposite, urinating much less than normal because their kidneys are shutting down. You might also notice your urine is darker than usual, appearing brown or tea-colored, which can indicate blood in the urine. Any persistent change in how often you urinate or what your urine looks like deserves immediate medical attention. The 5th warning sign is persistent itching, especially severe itching that gets worse at night. When waste products build up in your blood due to kidney failure, they can cause intense, maddening itchiness all over your body. This is called uremic pruritus, and it happens because toxins that should be filtered out are instead depositing in your skin. Many people scratch until they bleed, and no amount of lotion or cream provides relief because the problem isn't on your skin surface. It's coming from inside your bloodstream. This symptom is often missed because people assume it's just dry skin or allergies. Now that you understand the warning signs, let's talk about what you can actually do to protect and heal your kidneys. I want to be very clear about something important. If you're experiencing any of these symptoms, you need to see your doctor and get your kidney function tested with blood work and urinalysis. Early detection is critical. But here's the good news. Kidneys have a remarkable ability to heal and regenerate when you give them the right support. The strategies I'm about to share are backed by medical research and have helped countless patients improve their kidney function naturally. The single most important thing you can do for your kidneys is to dramatically reduce your sodium intake. Most people consume over 3,000 milligrams of sodium per day, but your kidneys function best with 1,500 milligrams or less. High sodium forces your kidneys to work overtime, raising your blood pressure. A balanced low-sodium meal like this helps protect them, which damages the delicate blood vessels in your kidneys over time. Start reading labels carefully. Avoid processed foods, canned soups, deli meats, and restaurant meals, which are loaded with hidden sodium. Cook fresh whole foods at home using herbs and spices for flavor instead of salt. Proper hydration is crucial for kidney health, but it's not just about drinking more water. It's about drinking the right amount at the right times. A good rule of thumb is to drink enough water so that your urine is pale yellow, almost clear. Dark urine means you're dehydrated and your kidneys are struggling to concentrate waste. However, if you already have advanced kidney disease, you might need to limit fluids, so work with your doctor. For most people with early kidney issues, drinking filtered water throughout the day, not all at once, helps your kidneys flush toxins efficiently without overwhelming them. Certain foods have specific protective benefits for your kidneys. Berries like blueberries and cranberries are rich in antioxidants that reduce inflammation in kidney tissue. Red bell peppers are low in potassium but high in vitamins that support kidney function. Cauliflower and cabbage help break down toxins that can damage kidneys. Garlic provides immune support and reduces inflammation. Olive oil contains healthy fats that protect against oxidative stress. These foods specifically target kidney damage and help repair tissues at the cellular level. Controlling your blood pressure is absolutely critical for kidney health. High blood pressure is both a co-consequence of kidney disease, creating a vicious cycle. The blood vessels in your kidneys are extremely delicate, and high pressure damages them irreversibly over time. Your target blood pressure should be below 113/80 and ideally closer to 120/70. If you're on blood pressure medication, take it consistently. Lifestyle changes like reducing sodium, losing weight, exercising regularly, and managing stress can be just as effective as medication and work synergistically with your treatment. If you have diabetes, managing your blood sugar is essential for preventing kidney damage in your kidneys through a process called glycation, where sugar molecules attach to proteins and create harmful compounds. Over time, this causes scarring and permanent loss of kidney function, a condition called diabetic nephropathy. Keep your hemoglobin A1C below 7%, ideally below 6.5. Monitor your blood sugar regularly, take in medications as whole foods, avoid refined carbohydrates and added sugars. You need to be extremely careful with over-the-counter pain medications, especially NSAIDs like ibuprofen, naproxen, and aspirin. These drugs are nephrotoxic, meaning they're directly toxic to kidney tissue. They reduce blood flow to your kidneys and can cause acute kidney injury or accelerate chronic kidney disease. If you take these medications regularly for arthritis or chronic pain, talk to your doctor about safer alternatives. Acetaminophen is generally safer for kidneys when used at recommended doses, but even that needs to be monitored. Many people unknowingly damage their kidneys by taking NSAIDs daily for years. Regular moderate exercise is one of the most powerful things you can do for kidney health. Physical activity improves blood flow to your kidneys, helps control blood pressure and blood sugar, reduces inflammation throughout your body, and helps you maintain a healthy weight. All of these factors directly protect your kidneys from damage. You don't need intense workouts. 30 minutes of brisk walking 5 days a week is enough to make a significant difference. Swimming, cycling, and yoga are also excellent choices. The key is consistency. Make movement a non-negotiable part of your daily routine. Certain supplements have strong research supporting their kidney protective effects. Omega-3 fatty acids from fish oil reduce inflammation in kidney tissues and slow the progression of chronic kidney disease. Studies show they can reduce proteinuria and preserve kidney function. Coenzyme Q10 is a powerful antioxidant that protects kidney cells from oxidative damage, especially important if you're taking statin medication. Alpha-lipoic acid helps reduce diabetic kidney damage, and vitamin D is crucial, but low vitamin D accelerates kidney decline. Always discuss supplements with your doctor, especially if you're already on medications, because some combinations can be harmful. Chronic stress is an often overlooked factor in kidney disease. When you're under constant stress, your body produces cortisol and adrenaline, which raise your blood pressure, increase inflammation, and directly damage tissues. Stress also leads to poor lifestyle choices like emotional eating, skipping exercise, and inadequate sleep, all of which harm your kidneys. Incorporating stress management practices like meditation, deep breathing exercises, progressive muscle relaxation, or even just spending time in nature can measurably improve kidney function. This isn't just feel-good advice. The research shows that stress reduction techniques lower inflammatory markers and slow kidney disease progression. Let's talk about what you need to avoid. Processed meats like bacon, sausage, and deli meats are loaded with sodium and preservatives that stress your kidneys. Canned and packaged foods contain excessive salt, even when they don't taste salty. Dark colas contain furic acid that damages kidneys and leaches calcium from your bones. If you have advanced kidney disease, you also need to limit high potassium foods like bananas, oranges, potatoes, and tomatoes because damaged kidneys can't remove excess potassium, leading to dangerous heart rhythms. Dairy products are high in phosphorus, which can be problematic for kidney patients. Read labels carefully and work with a renal dietitian if needed. Alcohol and smoking are particularly devastating for kidneys. Alcohol dehydrates you, raises your blood pressure, and forces your kidneys to work harder to filter toxins. Chronic alcohol consumption directly damages kidney cells and accelerates the progression of kidney disease. Smoking restricts blood flow to your kidneys, damages the blood vessels that keep them healthy, and dramatically increases your risk of kidney cancer. If you smoke, quitting is the single most important thing you can do for your overall health and your kidneys specifically. If you drink alcohol regularly, cut back significantly or eliminate it entirely, especially if you already have kidney problems. Regular monitoring is essential. If you have risk factors for kidney disease like diabetes, high blood pressure, if you have a family history, or if you're over 60 years old, you should have your kidney function tested annually at minimum. The two most important tests are serum creatinine, which measures waste product levels in your blood, and GFR, or glomerular filtration rate, which tells you what percentage of kidney function you have left. This is the serum creatinine test result. You also need a urine test to check for protein or blood. These tests are simple, inexpensive, and can detect kidney disease years before you have any symptoms. Early detection means early intervention, which can prevent or reverse damage. I want to emphasize something crucial. Kidney disease is not a death sentence, especially when caught early. I've seen patients reverse early kidney damage and dramatically slow progression through the strategies we've discussed today. Your kidneys have remarkable healing capacity when given the right support. But this requires commitment. You can't implement these changes for a few weeks and expect miracles. This is about making sustainable lifestyle changes that become your new normal. Work closely with your healthcare team, get regular monitoring, and stay educated about your condition. You have more control over your kidney health than you might think. Your kidneys want to heal, your body wants to be healthy. But it needs your help and your consistency. Every meal you eat, every choice you make about movement and stress and sleep either supports your kidney health or undermines it. The good news is that these aren't deprivation strategies. Eating fresh whole foods, staying hydrated, moving your body, managing stress, these things make you feel better immediately. You'll have more energy, sleep better, think more clearly, and yes, your kidneys will thank you. This isn't about perfection, it's about progress. This is so nice.
It really is. Thank you.
If you found this information valuable, I encourage you to share it with someone you care about. Kidney disease affects millions of people who don't even know they have it yet. You might save someone's life by sharing what you learned today. Make sure to subscribe to this channel because I regularly post evidence-based health content specifically for adults who want to take control of their health naturally. And remember, always consult with your own healthcare provider before making significant changes to your diet, exercise, or medication routine. What works for one person might not be appropriate for another, so personalized medical guidance is essential.